Former CNN anchor Veronica Cruz is with us right now, and you are here. We'll show a clip of you. You are a healthcare advocate, but this is not a general. This is very personal and very real in her life. Her brother died while waiting for a heart transplant. His surgery denied and delayed after being turned down for health insurance because of a pre-existing condition and other issues. Let's take a look at her right now, working on the issue of healthcare.
So we're walking around the streets of Manhattan, and the topic of discussion is health care. We're asking people if they think it's an important issue in the election, and we're asking how they feel about the candidates' plan. How do you feel about health care? Is that a really important issue to you in the election?
I looked up a lot of stuff about healthcare in other countries, and I feel like America's healthcare system is not up to par at all. The latest numbers is 40 million children in the United States are either uninsured or underinsured. That's ridiculous.
All right. First of all, a lot of people, you know her from CNN.
Welcome.
It's nice to see you.
Thanks for having me.
Thank you for being here.
This is such an important issue, and I'm glad you guys are helping me raise awareness. It means a lot.
Of course.
This is personal. We were chatting before. It is very personal for you. It is such a huge moment in the life of you, your family, your late brother. You've chosen to take the path to help a lot of others from this thing. So where are you at that now?
Well, we are pushing for healthcare reform legislation, healthcare insurance reform, because there are so many people who don't have it. And even if they do, they might be underinsured, which is what happened with my brother.
And what specifically happened? Yes.
Well, my brother was diagnosed at the age of 22 with dilated cardiomyopathy. He had a heart condition. And he had Nevada Medicaid, but that's not portable. You can't take it out of state. And he was living in a state that didn't have a transplant center. So he had to go out of state for this surgery.
Oh, my goodness.
Yeah,
and catch 22 for him.
Yeah, so the only way around that was to get him federal Medicare. Of course, we could have gotten him insurance through a private insurance company, but nobody would insure him because of a pre-existing condition. So getting him Medicare was a 5-year process. The surgery was going to be $1 million. So while we were working on getting him Medicare, we were also fundraising, and I started a campaign through Twitter, and thousands of people organized online. It was the most amazing thing I've ever seen. And, I covered social media, new media at CNN, and I hadn't seen people mobilize like this since the presidential election.
And for something good, which Steve always points out, and most of the time you're right, there's a lot of junk out there on the Internet.
And this story, your story, your brother's story is in Glamour magazine that I just bought with Scarlett Johansson on the cover. If you want to show it and you show people.
Yeah, it's right here. Again,
it's wonderful
kudos to people like you and obviously to Glamour magazine, and thank you to Marina who wrote the story and did such a wonderful job with
Glamour, it isn't just superficial surface fashion stuff. They've always highlighted cancer stories of real people struggling, and I think that's important.
And and this is a real story. It happened to me. I want people out there to know that this can happen to you.
What's helping your family emotionally by raising awareness and keeping this going, not letting it pass with your brother?
It's been really hard. It's been really hard. My mom struggles. I mean, it's only been 3 months, so there are good days and there are bad days, and yes, it's keeping me busy, so it's great.
How's your mom?
She's struggling. She's not
boy.
doing very well.
I said to you earlier when we were talking about this that what you're doing right now, it's not only a place for you to go at this point, but for your brother. Brother, there's nothing better that you can do than help other people. There are very specific people you've already helped and saved lives with, and that's just the beginning.
We helped our first person, Kelly Williams, who's 34. He's a father of 4. I took him through the exact same process that Eric went through. He had a successful outcome, which is great. He was a Las Vegas resident, caught in the same kind of black hole where he couldn't get supplemental insurance. The joke is that we raised nearly $1 million for Eric, and even after we were able to secure his Medicare, which took us 5 years, we raised all that money. We tried to get him to UCLA Medical Center. We had $500,000 at that point, and they said that's not enough. You still need supplemental insurance. So I'm trying to show people the importance of health care reform.
There are so many people are so afraid. They're ignorant. They're like, oh my God, this is socialization of America.
I was just telling you, I went on a blind date a couple days ago, and the guy goes, oh yeah, a friend set us up, and he goes, oh, I hear you're a TV correspondent. And I said, yeah, I'm really, really busy with healthcare reform. And he goes, you support that? And then I told him about my brother, and
He was one of those people that thinks it's going to be socialization, though.
Yeah, he said, I don't want to turn into communist China. I mean,
but,
this is...
I always tell these guys, I grew up in Canada where we have socialized medicine. There are definitely downsides to it, but everyone's treated the same, whether you need an open heart surgery or a cut on your finger. They don't turn you away.
45,000 people die every year because they don't have insurance and they can't get to a hospital. And those people die from treatable illnesses.
Healthcare reform takes many forms. Many forms. When you talk about healthcare reform, to the guy who's reacting, you're talking about public option. You're talking about government involved. That's one method of healthcare reform.
But we've got a lot closer today, and you're a news person, so I'm sure you know this, because the Senate bill, it looks like the Senate bill will actually not cost as much money as was previously thought, and it may pass.
And as you know, even for those of us who follow it, we don't understand it.
There are a million bills out there. The bills have passed through the House. They're going through the But those two bills need to be combined. But
if the Senate bill passes, this is an enormous step in the direction that you would like to see.
Absolutely. What's most important to me is that people who have pre-existing medical conditions, they can't be denied. They can't be discriminated against. Because honestly, this is a basic human right. Everybody should have access to health care.
That's right. And they're the ones who need it more.
Yeah, insurance is such a scam. Insurance is such a scam. These are companies that aren't providing health insurance for people who actually need it.
Well, remember, insurance companies are in the business of making money.
Right.
So they will do, it's instinctive. You do what you can to make money. This is why there has to be reform.
That's unconscionable to rescind people's policies who get sick.
It is.
And to exclude people who are sick.
And interestingly, I know we got to go. There's nobody even on the other side of the issue that you are on, politicians, who will say, we're in favor of rescinding coverage.
There's an article in the New York Times, an op-ed that the writer says, if this doesn't pass, then every member of Congress should lose their health insurance.
So they've got the best.
Just so they have how it feels.